Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi, and sorry for having a little bit of a delay and having a podcast come out on this very important topic we've been talking about for 2.5 years and trying to bring you updates as well on the COVID pandemic. We were away at the NDSC convention. I was with my family, and so it's nice to be back home and be able to be back with our resident COVID expert, Dr. Andrew Nowalk, with me today to talk about all of the updates since our last COVID podcast, as well as some very important new information that hopefully you've all heard about the COVID vaccine availability. Dr. Nowalk, thank you for joining us again.
Thanks for having me, Kishore. I know the great thing is I get to see you again and chat, but the sad thing is there's always something new to talk about COVID. So.
Oh my goodness, for sure. Well, I think everyone on our podcast already knows you, Andy. And so I think what we can do, just in the interest of trying to make sure we stay on topic here today, why don't we just go ahead, as we always do, just give our audience just a little bit of an idea from your infectious diseases background of a general kind of COVID update. Where are we with our current COVID pandemic situation, Omicron wave, all that stuff?
So yeah, where are we? I think we are in that a phase of the pandemic that was probably pretty predictable. I think what we have seen, what we talked about in many previous podcasts were the initial waves of the virus, and we were all stuck at home, and we actually avoided having that many cases because of that period of time. And then we have gone through successive waves, and each of those waves has tended to be defined by the virus evolving. So the virus, as we've gone through all the Greek letters from alpha to beta to delta to Omicron, the virus has evolved a lot. And what it has evolved is that it has become much more contagious, unbelievably, because the very initial strain was pretty contagious. Now it's moving up towards measles contagious.
Yeah.
And we have evolved as the virus has also become less severe, I think, in its evolution. And we have evolved, and, people are less careful. I mean, there's no other way to say that. Certainly, there's a combination of fatigue, because we are all tired of being masked. There's a combination of loneliness, because we're all tired of being separated from each other. And then there's a lot of politics and disagreements wrapped up in that, which I won't comment on, but have certainly not helped us along the way here.
Sure.
So where are we now? So we are in wave whatever. So what this last wave has been characterized by, and you always hear me talk about the CDC data, is the CDC data. If you look at it, we have been for the last couple of months at about the same. We've been stuck around 100 to 150,000 cases a day in the United States. And these data now, for the first time as an ID practitioner, I am actually not sure what's going on by looking at the CDC or the local data, because what we've had is the explosion of home tests, which is great. I mean, I will say is great. And the availability of home tests is fantastic. I will reveal that I got COVID in the last couple of months. So in May, I got COVID through a family member. And the way I knew that everybody in our house turned positive in terms of me within 12 hours of turning positive was we had a ton of tests that we could take. So that's great, because rapid diagnosis at home means being able to isolate from people and prevent other infection, means being able to start medicines if you need them, and means being able to try to protect loved ones around you, although this is very contagious. The downside is I don't know what our real numbers are.
Yeah.
And so it's very challenging now to say, does the CDC number show us what there actually is? And I would say probably not. And so that can be a little bit challenging. What I would just say about what I think there's a ton of COVID out there right now.
Yeah.
And it's just now, it's a steady flow of people getting infected. And what characterizes the current infections is that they are far less severe than they ever were before.
And I think one thing that I have heard, and definitely people will comment in the news media and things like that, is if we know that whatever numbers we're getting from the CDC are a really underestimate, significant underestimate, because home testing, of course, is not reported very often. So what this would tell us is that there are Maybe, I don't know. I've seen up to 20 times more infections in some of these newspaper articles, saying that we have probably 20 times more infections, but yet our death rate is relatively lower. Severity of disease, while we're seeing more hospitalizations, it's not climbing like it was back in earlier phases of the pandemic. So what would we say, or how would you respond to someone who might say, we have so many more infections, it's obviously much less severe because we have less people dying from this disease than ever before in this pandemic. How would you respond to someone who is saying, hey, we're done with pandemic?
So, pandemics are defined not by the rate of infection, but severity and increased mortality. And when folks say to me, we're done, it's harmless now, I just point out to them that we're still averaging 300 some deaths every day.
Yeah.
And that figure is a high figure. That's a really large figure. That averages out, if you think about it, in a month, 300 times 30 is about 10,000 deaths in a month. And so, it averages out to about 100,000 deaths in a year, just to give people a perspective. So this mild disease we're seeing now, a bad flu season in the United States kills 20 to 30,000 people. So we have done everything we can with medicines, vaccines, and prior infections to reduce the severity of COVID in the United States. We still haven't reduced it to the level of an extraordinarily severe flu season by a factor of 2 or 3-fold. And children are still dying. So when I'm a pediatrician, as are you, and I'm a pediatric ID doc, the people dismiss this in kids all the time. We've had 2,000 children die during this pandemic from COVID. That is about 10 to 15 to actually 10 to 20 times a bad flu season for kids in terms of mortality. So yes, it has moderated. Yes. Fewer people are dying. Thank God. That was such a blessing. But no, this is not trivial. This is the worst infection we have right now. This is by far and away, and has been for 2 years, the number one infectious disease causing mortality in the United States. 100,000 people is a lot of people. 2,000 children is a tragedy. Yeah. So I would urge folks who listen to the pod to still recognize this should still factor into your calculations about keeping your children and your families safe, and especially your loved ones with Down syndrome. You should still think about it. There are things we can do to help protect them, mostly vaccines, but the other things about being around people who are sick or, travel and all those things, it doesn't need to drive fear, but it needs to drive sound decision making.
And I think you hit on a really important point, and you and I have been discussing back and forth with papers as they come out, looking at any Down syndrome specific concerns or any signals with these waves of COVID that have gone through. What are we seeing now in terms of your interpretation of the data of what we can expect for somebody with Down syndrome who gets this virus?
So what I would say is that we know a lot now. One of the phrases I used the most on the pod early on in the pandemic was, "I don't know." Yeah. We didn't. We were improvising on information that sometimes changed the minute the pod came out. But now we have really good information, and we have it from a lot of different sources. We have it from a single hospital in New York City. We have it from the UK's national health system. We have it from large insurance databases in the United States. We have several national studies throughout Europe. As the European groups, especially in Italy and the UK, have done a fantastic job publishing really good data about this. And so we have learned that people with Down syndrome do not seem to be dramatically more susceptible to COVID. So they're not tenfold more likely to get it compared to a typical individual. But when they get COVID, it is more severe than in a typical individual. So in a typical individual who doesn't have Down syndrome, their risk for going to the hospital is going to be less than a person with Down syndrome. And a person with Down syndrome who's in the hospital has a significantly increased chance of dying from COVID if they are in the hospital compared to someone who doesn't have Down syndrome. Those data, I don't think, Kishore, they're in dispute anymore. We know that this is a more severe infection in people with Down syndrome. And that's not a surprise. We knew that about RSV in children. We had always suspected it about influenza in children and adults with Down syndrome. So it's not a surprise at all, but the data are now very, very good. You need to be very cautious with your loved one with Down syndrome because their risk is much higher than another person's.
Do we have any information specifically about kids with Down syndrome, or is this just in general still we're seeing more with adults?
Yeah, we don't yet. I think you and I should talk about that. I have a really good idea on how to get that. And I've been playing around with some data from a couple of national sources. We don't have that yet that I know of. I don't think you and I have shared a paper that is convincing about children, but we certainly have seen a number of children at our hospital anecdotally who've had pretty severe disease with Down syndrome. And we know from the reporting from like the T21RS, the Trisomy 21 Research Society, which is an international group that I've had the opportunity to work with a little bit, just an amazing group through the patient and family study that they've done doing for the last 2 years has yielded very rich data about a lot of very bad outcomes in people with Down syndrome. So I think we would anticipate the children are going to look the same as adults here.
Okay. And speaking of kids, I want to just highlight a couple of different age groups where big information has come out probably since our last podcast together. Let's start with the 5 to 12-year-olds. So the 5 to 12-year-olds were approved for vaccination in this country many months ago now. We haven't seen the greatest of uptakes in this vaccine, which I would love your comments on for this 5 to 12-year-old age range in terms of how to address hesitancy perhaps that parents may have with vaccinating this age group, 5 to 12 years old. And so why don't we start with there in that now we have this vaccination of 5 to 12-year-olds and boosters also recommended for this age group. So maybe comment on both primary vaccination for 5 to 12 and boosters, what your thoughts are on getting those for this age range.
I think that this is an area where it makes me absolutely despise politics because politics, I think, has driven a lot of parents' decision making, not data. And the uptake in this group has been poor. It's poorer than influenza vaccine. Mm-hmm. And I want to stress and emphasize the vaccines we have for COVID, the current vaccines, which were designed against the virus we saw 2 years ago, has been gone for a long time, are still more effective than the majority of flu vaccines that we use. So these are safe and extraordinarily effective vaccines. In the 6 to 11-year-olds, we have not seen the myocarditis complication with any frequency that we saw in that very tight band of adolescent males between about 16 and 18, which is where almost all of that signal came. So, it's been a really safe vaccine in this group, and it's been very effective when the children get it. So there is no reason not to get the primary series. There is no reason not to get the booster. I mean, this vaccine works. It really, really, really works. Mm-hmm. And people should go out and vaccinate their children. If their child has Down syndrome between the ages of 6 and 11, that child is at risk of dying more often than another child from COVID. Who wouldn't want to prevent that and protect their child? So I would give you a lot of good reasons for why people haven't been doing this, but it's hard. It's hard for me as a pediatrician when I have a life-saving tool to see people choose not to use it based on what is bad information. You go to the media and you go to Twitter and you go to Instagram and you go to Facebook, and I see routinely people spreading information that is just wrong. And sometimes is really facilitated by this like nefarious orchestra of bad sources who really don't seek to try. They don't have any investment in COVID. They really want you to buy something they're selling, or they're interested in driving political differences. Mm-hmm. So it's challenging. So, no one's surprised listening to the podcast to hear me say this. This vaccine saves lives. It could save your child's life. You should get it.
Yeah. And I think your phone ringtone really does accentuate.
I just wanted to emphasize my point.
Bad to the bone right there. So I hear what you're saying. And I think that there's a group of folks with significant vaccine hesitancy won't even start the primary series. I've been getting questions this summer, especially from families who were probably the first in line to get the first 2 doses. and are waiting on the booster because they're seeing the news reports that we're going to have an Omicron specific vaccine most likely come this fall. And they're wondering, should we wait on the booster until the fall so we can get an Omicron booster instead of having to get two different vaccines? So what were your thoughts beyond that?
Oh gosh, that's a hard one.
Yeah, that's what I say.
Wow, that's a hard one. And that I would say that I don't have a snappy answer for that. On the one hand, part of me says the vaccine's right there in front of you. The protection is right there in front of you. We know that protection is not perfect or ideal against Omicron, but in the first couple of months post-vaccination, people get really excellent protection. So I would say that's a really good argument to do it. We don't think that the Omicron boosters will be out until October. Okay. Or maybe November. So you may actually be able to double boost your child at that point. There is no right or wrong answer to that. And I think it depends a little bit on exposure. If your child is at home with you during the day and, maybe you homeschool, or maybe your community is small and there's not much concern for COVID coming in without you knowing it. So yeah, I don't know the right answer to that.
Yeah. I'm glad, because that's kind of how I've responded to the families too, which is that's a really tough call in that we know something eventually is coming. But as we've seen throughout this pandemic, sometimes we think something is coming in September, October, and it takes a few more months. And that's part of the things we've been talking about on this podcast together, you and I, which is we're really having to be extra cautious, particularly with children. And I love that, because I would hate if people are like, okay, yeah, just give it a shot with them. No, they're really trying to make sure it's safe. And so, but yeah, hopefully by the fall, we'll have those boosters, and individual families, I suppose, until then, when their child is due for boosters, which, Andy, remind me, boosters for this age range is how many months after the primary vaccine? 6 months. Okay.
Yeah, 6 months. 6 months has been the typical time frame that we're having people boost.
Okay, great. Now, here's the big news, of course, and one that we've been talking about for the last, many months, but really over the last couple of weeks especially, is the primary vaccination series now being available to children as young as 6 months of age. And so here again, we're seeing families with some significant hesitancy, and I suppose your answer will be the same for this group, but I don't know. Let me know. 6 months to 5 years, what would you say? If a parent came to you and say, should I get this for my 6-month-old?
A physician who I have much respect for in the hospital came up to me in the hallway this week and said, would you really do it for a 6-month to 5-year-old? And I pointed out to him that 400 children in that age range have died. Mm-hmm. And I pointed out to him that is the leading cause of death from infection in that age group. This person is someone who treats our acutely ill children all the time. And I'm like, more children are dying from COVID than from sepsis. Mm-hmm. And I point out to him that, the highest individual death rate in any of the age groups is in 0 to 4. So we talk a lot about the 2,000 children who've died between 0 and 18. If you break them into the buckets, 0 to 4, 5 to 11, 12 to 18, the highest rate of death is in 0 to 4. Mm-hmm. Because we have a lot of really tremendously vulnerable children between age 0 and 4 with medical complexity, especially. So for me, that's clear. And, that physician is a very smart guy and follows a lot of literature, just never saw it put that way. Mm-hmm. And so, that's something good for you all listening to spread. 400 deaths between the age of 0 and 4, again, a tragedy. It's a tragedy. And if we can prevent one of them, I hate to get all biblical, just one, we should prevent it. We do a lot of other things routinely that are much less effective than COVID vaccine, like putting seatbelts on children to protect them. Why we wouldn't vaccinate this age group is beyond me. It will be safe and effective in this age group. And the data on side effects is that they are muted compared to the older kids, because this dose was reduced in order to achieve the balance between a good immune response and reduced adverse effects.
Yeah. And I guess part of the confusion too exists, which is there are two different products again for this vaccination series. And families wonder, well, should I give my child 2 shots, which would be, I think, the Moderna version, or should I give them 3 shots, which would be Pfizer? And which one is better, and which one lasts longer, and all these questions. How would you answer to a family who says, I don't know which one to get?
I would say it's, do you want to drive a Rolls Royce or a Mercedes? They're both fabulous. I think I will not endorse one or the other because they're both very effective. And I think part of this is certainly about how many times you want to go. They are both roughly as effective as each other. They both are going to prevent disease. So I would get the one that is right in front of you. And if you have a lot of choices, then I would sift through the data. The one thing I always fall back on, and this is the same as the question you just asked about, do you get a booster now or wait for the Omicron booster? I have such faith in the parents who are listening to this that they will make the right decision. And I will just say to them, I would look at the data. You are smart and hardworking and you do everything you can to care for your child. That's probably why you're listening to the podcast. I would look at the data about 2 versus 3 and look at what's published about the efficacy. And then whatever you decide is the right thing to do.
Okay. And in this group, because it's obviously a primary vaccination series, we're not talking about a booster here. We're talking about the first time they're ever getting this vaccine. Is this a group that you would say, let's wait a little while longer and see if an Omicron specific arrives? Or would you say they are so naive to the virus at this time that we should get whatever vaccine is available now, and perhaps later, if we move in that direction of boosting, get an Omicron booster at that time? How would you respond?
Finally, a question I can answer.
Yay!
I would say get vaccinated right now.
Okay.
One of the things that makes me a little nervous is that when very smart people parse out the severity of Omicron versus previous strains, it is very clear that it seems much less severe. However, so many people are vaccinated or previously infected that does skew the data. So a large proportion of why, 85% of people in the United States now have had a dose of vaccine. So that's a lot of people, which means that it's very hard to find an infection that doesn't meet someone who's not vaccinated. Many of the vaccinated people have gotten COVID. I did too. It was really mild. I probably right now, based on studies, have an amazing repertoire of antibodies. The folks who are unvaccinated in the United States, there's probably 2 of them left who've not gotten COVID because it's so contagious among the unvaccinated. But what we're nervous about is that the severity in a completely naive, unvaccinated person is probably going to be not trivial. So we think that a lot of the gains we've made in terms of deaths, hospitalizations, and severity of disease are certainly not trivial. And the one thing I'd say about the 0 to 4 is we don't have anything to give those kids. Mm-hmm. So Paxlovid, I'm happy to reveal personal health information. I have a chronic medical condition. I took Paxlovid. So I had access to a medication that moderated my course of virus. I was not that sick. If that had not gone well, I had friends who are on medicines that didn't allow them to take Paxlovid, but they got antibody infusions. So that's 2 different things that we know work tremendously well. In children under the age of 4, you have access to neither of them. So you don't have any of the therapies to protect you. And if you have a naive to COVID child, you can expect there will be severity of disease that is going to look a little bit more like the original strains. So having said all that, that's risk. Yeah. That's increased risk. Get your child vaccinated right now.
Yeah, perfect. And I think one of the things that's been so fun to see on social media and whatever is all of my colleagues who have young children in this age range, putting pictures of their children, some of them flexing, showing how strong they are to be vaccinated and things like that. I think that messaging from us as a medical community would be really, really powerful for families to see as well.
I have a son with Down syndrome. My son, Peter, is 16 years old. The day it became licensed for 16, I got him vaccinated. The day people said, go ahead and boost that group, I got him a booster. This is, I will say from personal experience, I would never do anything to put my child in danger. And I looked at all the data and I ran to the vaccine as quickly as I could because I knew it could potentially save my kid's life.
Yeah. Well, very powerful. I think that this is at this point, I think we've gotten our listeners up to date with our current state of things with COVID, the pandemic, the vaccines that are available now. Is there anything else that we should be discussing today before we close the podcast?
One nerdy thing, and then one future, trying to look to the future, because we do that a lot,
Yeah.
We've been burned a lot looking to the future, but we do that a lot. The nerdy thing is I had the real privilege of participating in the Down Syndrome Medical Interest Group, which you got me involved with, Kishore, their conference recently. And the conference focused on nerdy basic science around vaccine responses. And again, kudos to colleagues in Europe who've done some beautiful work around this, both in the UK, Germany, as well as Italy. Some really tremendous presentations of data that I was privileged to hear and kind of comment on. And what they presented was something that I want to reassure parents about. We have always had some concerns about our people and our loved ones with Down syndrome responding to vaccines in the same way that people without Down syndrome do. And there's actually some data for a few vaccines that is pretty clear that they don't respond quite as well. When they looked at responses to the newer COVID vaccines that are based on mRNA, and that is Moderna and Pfizer, their responses looked a lot like folks who did not have Down syndrome. The comparison groups were typically healthcare workers in both of the studies, but their responses looked pretty comparable. That is incredibly exciting. That is incredibly exciting because we always have some nervousness about the responses being equal. It's also tantalizing because it suggests that the mRNA platform may be a way to raise really good immune responses in people who might historically have not responded as well. So that's a beacon of hope. When you get your child vaccinated and you have a 2-year-old child who has Down syndrome and a 4-year-old child who does not, who are two of your kids, they'll predictably, we think, have equal responses, which is great.
Yeah.
And then predicting the future, we've been to meetings in cities recently. I've traveled again. So have you. Nobody's wearing a mask. Yes. I mean, a few people are wearing a mask, but it's pretty clear that folks have gotten to the point where they either are too tired or they've risk estimated and said, I'm vaccinated or I'm previously infected. And so most of the bad stuff that was going to happen with this has happened. So I'm going to go out in the world. So what does that mean to predict the future? Well, it probably means we're just going to continue to see virus. I'm hopeful that Omicron-based boosters will start to really suppress the amount of virus that we see. But when you look at the CDC data, we have a lot of virus. And what's happened over the last 2 months in particular is it's evolving constantly. We used to have Delta and then we had Omicron. And then as it turns out, we get to have a million different kinds of Omicron,
yes,
pain in the butt names, and they're BA1, BA2, where, we have BA1, BA2. I will tell you in the United States right now, we're on to BA4 and 5.
Yeah.
I will caution you, if you go on social media, I find it charming that people are always like, BA5 is going to wipe us out. That's nonsense. That's just people doom scrolling. But what that says is the virus is continuing to evolve because it has the opportunity to reinfect people a lot. So if I had to predict the next 6 months, I suspect we're going to see a constant stream of COVID. Yeah. We are all in infectious disease, eagerly awaiting this virus to shape up and start acting like a normal respiratory virus, where, we see it in the season with a seasonality, hopefully winter like the other ones. But some colleagues in infectious disease have raised the question that there are a few respiratory viruses like parainfluenza 4 particularly and adenovirus that happen for the most part year round. There's a little bit more in the wintertime, but they're year-round viruses. And they're saying, well, maybe we'll never get to seasonality. Maybe we're just going to have to vaccinate to have everybody have a lot of antibody and vaccinate to the point where we can reduce the severity of this to look more like influenza, and it's not even close to that yet. So if I had to predict the future, I would predict that in 2-3 months, we'll have lots more data to talk about because there'll still be 100,000 cases a day in the United States.
Well, we are glad that you will be with us to discuss those things.
I
hope. For our listeners, I told you, we were before we even started recording that at the convention this past week, everybody was coming up and saying, "Yay, you're the guy who does that podcast, and the other guy who you guys talk about the COVID. It's been so helpful." And I appreciate that. Any listeners who were a part of that group that was coming up and just saying hello, I really do appreciate that. And I thank you, Andy, for being a part of these podcasts as well and giving this information, because there's nowhere else that families are going to be getting this kind of up-to-date information. So I appreciate your sharing your time with us today, as always. To our listeners, I want to encourage you, reach out to us even now. Send us an email to downsyndromecenter@chp.edu. Tell me what topics you want us to cover. We're almost 150 podcasts in here. And so topics, I'm happy to re-release topics on information you want to hear about again, perhaps updated information on again, or really anything that you have. We've got several on the road on the road to coming, but I just want to make sure that we're addressing what you guys want us to address on this podcast. As always too, if you want to contribute and become a part of what we do here at the Down Syndrome Center, please do consider joining us at www.givetochildrens.org/Down Syndrome Center. Be happy to involve you in what we do here at the center, including this podcast. But until next time, bye-bye.